welcome to a new episode of Frank About Health. We're here at the beginning of the month of June in the Doubletree, Chicago, right here with Karen Ross. We do another tribute. This is Alzheimer's Awareness Month. And for that reason, I will, one, issue a disclaimer, and then two, explain what our show is about today. First of all, any of the information are not the views that are expressed today are not the views of Karen Ross Now, Frank About Health, talkradio.nyc, or in our guest case, Northwestern University. Sorry. That being said, take the information as food for thought. Use it if you are a person who is either a caregiver or who is suffering with Alzheimer's or some form of dementia, as information that you could talk about with your neurologist, social worker, primary care physician, and then determine if what we offer you today is information that'll be of some use to you. Otherwise, if you're just here attending episode number 119, I believe it is, to get information about Alzheimer's disease and the other forms of dementia out there, welcome. And just know that we're here to provide more transparent information about health. And in this case, I'm being frank about Alzheimer's with Karen. So let's explain who our guest is today. However, I will let Karen do the formal introduction. Our guest today is an advocate in many ways, through her research, through her other expertise in theater, as well as other aspects of her life in helping us understand how our brain works when it has the unfortunate condition of Alzheimer's disease or whatever other dementias are there. This particular episode of Frank About Health is going to be information gathering. It's not going to be highlighting a special cure or a solution or a doctor to go see or a podcast about Alzheimer's or a book. It's going to be information sharing. And it's important that I mention that because our guest today is the third medical professional to be on Frank About Health. And I am just trying to keep up with the respect of the profession, especially for such a critical condition of Alzheimer's disease, which I personally can relate to. More on that throughout the show. But at the same time, I'm being very sensitive to the information that we are sharing because I want to be able to make sure that we are as transparent about it and not giving any kind of misinformation or any kind of confusion related to a disorder that, believe it or not, creates confusion, especially in your brain. That's my own little beginning to this particular episode. That being said, our guest today is Lauren Dowden. And Karen, I'll let you take it away from here.
Thanks. Well, it's always nice when Frank comes in from Manhattan, New York City, and comes to Chicago. And as he mentioned, this is officially June, is Alzheimer's and Brain Awareness Month. So what better time to acknowledge and address the issue of Alzheimer's disease and dementia. And our special guest today is from Northwestern University, Lauren Dowden. She is a clinical social worker, and I'm going to let her do more of her introduction so I don't mess anything up. So Lauren, please share with our audience your current position and whatever you want us to know about what you're doing there at Northwestern and what's offered at Northwestern.
Yeah, thank you both, Karen and Frank, for inviting me to talk with you and to talk with your listeners. It's such a pleasure to be here and to have this conversation, especially during June, which is, again, all about cognitive health and awareness around Alzheimer's disease and other dementias. So yeah, my name is Lauren Dowden. I'm a clinical social worker. I'm at Northwestern University's Mesulin Center for Cognitive Neurology and Alzheimer's Disease Research. We are one of 37 Alzheimer's disease research centers in the country. So we really specialize in that specific topic. I am also Assistant Director of Outreach, Recruitment, and Engagement at the center as well. And so it's really important to me that in my role as a clinical social worker, I get the opportunity to meet with research participants and helping them along their journey And also, that's, I guess, I kind of wear two different hats, but the second hat I wear is a clinical social worker in our Northwestern Neurobehavior and Memory Clinic. And that's where I meet with patients and families who are experiencing different types of cognitive changes that bring us to our center. In our Neurobehavior and Memory Clinic, we have a team of behavioral neurologists, neuropsychologists, psychiatrists, and social workers, and we all work very collaboratively together to support people who come to our clinic for, again, like I said, various types of cognitive impairment. And so that is my background, and I'm very happy to talk about the work and anything I can do to help spread.
Well, your background and what you do with your team is so impressive. It really is. And there's an important question couched in what's been said already by Frank and by you. And you've used the word cognitive impairment, and Frank has referred to Alzheimer's disease as a type of dementia. I think it's being better known that there's been a misunderstanding that Alzheimer's disease covers all kinds of cognitive impairment. So is that a good place to start? The difference between the two and the fact that there is a difference?
Absolutely. I think when I meet with people the first time, that's one of the two questions they often ask. The one is, why am I meeting with social work? And we'll get to that in a second. But the other one is, what is the difference between dementia and Alzheimer's disease? And is there a difference? And the answer is yes, there is a difference. Really, dementia is an umbrella term. And the umbrella term is really saying there are cognitive changes to such a degree that they're impacting a person's ability to carry out what we call activities of daily living. And so there's activities of daily living, there could be, maybe how they're managing medications, how they're managing finances, cooking. Really, there's high level activities of daily living, as well as some other personal ADLs, we call them, like dressing and bathing. But those, usually are pretty intact. But some of those higher level, we call them instrumental activities of daily living, might start to be impacted by cognitive changes. And once those are impacted, then that's when it starts to veer into what they call a dementia. Now, with that term, there's different types of dementia. And Alzheimer's disease is just one very specific type of dementia. So you're right. Often people can, they say, oh, he has a dementia, and it just kind of is this general word that people use often. But really, there are so many different types, and how people present with different symptoms can vary greatly. And so, yeah, so that's the first thing I think it's very helpful for people to maybe understand, is that Alzheimer's disease is the most common. And
that's why we hear about it more. Okay.
Absolutely, absolutely.
So then what would be other versions of dementia?
So other types of dementia that we see in our clinic, again, it could be due to vascular changes. Sometimes people might have we call vascular dementia. And those are changes in the brain that, again, due to vascular changes. There's things we call frontal temporal dementias, and that means they're types of dementia that predominantly in the frontal network. And then also Lewy body dementia. And Lewy body, again, is a type of dementia. There's a new movie, I believe it's on Max, Lillian Hall, something about, anyway, Jessica Lange is in it, and spoiler, but anyway, she has a type of dementia, one of the ones I just said, that's not Alzheimer's. So I just think that's interesting if people are looking to see, wait, if it's not Alzheimer's, what does it look like? Or how does it present maybe?
Well, how is it diagnosed? And maybe this is too much of a question to answer in the first segment, and we'll continue the second time, but what is it that somebody should be witnessing in someone they love or a friend and determine that diagnosis is needed?
I think that's the best question, right? Because part of this is we know usually when I meet with somebody, it's maybe a partner, a spouse, a child. Sometimes it's a parent. Sometimes it's a sibling. So it's, it could be a friend. So somebody who knows the person very well. And sometimes the person themselves also is saying, hey, there's something not right here. Or the family or friend is saying, hey, I know this person, these things are happening. And I think often we attribute it to memory, right? We think of dementia, 9 times out of 10 people say, oh, it's memory. And often it does, but there's so many other ways in which somebody can change cognitively. So memory certainly is one. They might have difficulty finding words. So language might be one. So they might be having difficulty forming sentences or communicating. Somebody might be having difficulty with they might change like behaviorally. They might be a little bit more, we call it disinhibited, maybe doing things that they would not normally do. They might be less interested in doing things. They might, they might be somebody who's really gung-ho and now has a lot of maybe apathy and not doing things. There could be visual, we call it visual spatial changes, where it's not a vision problem, but they are perceiving things in a way that is not as it used to be. So those are just some other symptoms. But when you start to see someone, oh, wait, that's harder for them, or that's different for them. They're having more difficulty with finances, or they're having more difficulty. They're maybe making poor judgment can happen, right? So they're making decisions that you're like, oh, they wouldn't have done that before. That's something to keep an eye on. When everybody makes a mistake, so that's different than, oh, this is something a little bit deeper than that.
Yeah. I would imagine that the person who might be experiencing those changes is going to be very resistant to.
Well, I think that's really important. Like that word resistant, I'm a huge, I just did a talk on this. So with that, so somebody that has cognitive changes, some people have what we call insight, and they recognize that there's changes and they can be very proactive and they want to do what they can to add supports around the changes or do therapies around them. Now there's other people who have no insight. And that means they have, they are just not able, it's almost a symptom, it is a symptom, they're not able to recognize that there is a change. So it's less sometimes resistance and more, they think they're fine.
Yeah.
They don't think that there's a problem, and that's actually, it can be a symptom of the disease. And so, but that makes caring for somebody or adding support for somebody very difficult. And know that it's not one or the other. Sometimes people recognize there's something wrong, but they might not appreciate the severity of it. So there's also gradations in terms of what we call insight.
I want to go deeper into this second segment, but Frank.
Right, I did also wanted to say that I want to have some breakdown in terms of the different types of dementias and the difference between not just resistance, but resilience. So when we return, because we're about to take our first break, when we return right here on Frank About Health, please watch as we continue our discussion on Alzheimer's Awareness Month, right here on talkradio.nyc and on our social media platforms, YouTube, LinkedIn, Twitch, and Facebook. We'll be back in a few.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on talkradio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Welcome back. We're going to call segment 2 all about resistance versus resilience. And let me first start by qualifying the difference. Resistance, as Lauren mentioned earlier, is people who either have insight or don't have insight into if there are cognitive changes going on. Actually, those that have insight are looking to work with it or try to have some control over it, which means that they're trying to be resilient in accepting their newly created condition, which is still questionable as if it's genetic or environmental. But I did want to qualify something that you said earlier, Lauren, and that is in terms of the different dimensions. You mentioned Lewy body. Now, I of course, I think you and I have a familiar experience in the entertainment industry from a little bit of our conversation before the show. When I think of Lewy body dementia, I think of Estelle Getty, because she was on the Golden Girls. She was actually, I think, one of the youngest ones who played the old, Sophia, the mother of Dorothy. And she passed away from Lewy body dementia, but they all qualified it as Alzheimer's back then. My question is, why do they call it Lewy body? Is it actual organic substances forming in the brain versus Alzheimer's?
Yeah, so that's a great question. And, really it's the they're called Lewy body proteins. And these proteins, they impact how the neurons are basically interacting, engaging. So again, all of this, when we get into the pathology of the disease, we're really talking about the different types of changes on the cellular level that are impacting the neuron's ability to communicate as they once did, whether that's amyloid, whether that's Lewy body, whether that's a tau protein. And that's when it gets we're going to get into real deep neuroscience there. And so, but you're right. It's kind of the first step is trying to figure out what might be causing these cognitive changes. And that goes back to that diagnostic process, which can be a long process. So that's a whole other thing.
And I guess where the resilience and resistance comes in is that maybe both sets of people per se are aware of the changes, but the resistance are like, I can't accept that happening. So therefore, I don't even want to know what type I have. I'm just going to deny until the unfortunate occurs.
Yeah, I try to stay away from, personally, I stay away from the word resistance and denial because it sounds as if I'm making that choice when really what I'm talking about is an individual who doesn't recognize that there's a symptom. And their brain is just won't allow it, like it just can't see that there's anything wrong. And so again, it's just for them, they might not identify with needing support or identify with needing. And sometimes I'll meet with somebody and they said, I actually don't think anything's wrong. My husband brought me here. But they're there and they can be very willing to take part in things. So again, it's not one or the other, but it can make things a little bit more difficult if somebody doesn't identify or recognize. And again, that could be often very likely due to the disease itself.
You mentioned the diagnosis process, and you said that it can take a long time. What is the process? Do we not just take some blood and that tells us what we have? Why does it take a long time?
Wouldn't it be nice? Well, they're working on that part, right? But because we can't see the brain like we see other organs, And so it makes it really difficult. You know, we were talking about the different, the Lewy body proteins, for example, or things, it's on a cellular level. So it's really hard we can't get in there until, unfortunately, autopsy. So until then, we do, though, have things called biomarkers, which are ways to start to identify likelihood of certain diseases. So for example, if I'm noticing cognitive changes in my person or in myself, I might go to my PCP first, my primary care physician. They might notice it, or I might say, hey, I'm noticing it, or my family member might say, I'm noticing it. They might get a referral, let's say, to our clinic, and they might meet with a behavioral neurologist who will then maybe do some basic testing. And they might even see a neuropsychologist to really start to fine tune where these cognitive changes are happening. Some of the testing for diagnosis, there's going to be in-office cognitive testing. There's going to be, we need information from their, what we call collateral informant, which is really basically their family or friend. They might suggest, if there's concern about Alzheimer's disease, they might suggest an MRI is usually first. It's the least invasive. And they might say, hey, is there anything else going on in the brain? We want to figure out what isn't it, right? We want to kind of, let's make sure it's not something we can treat. That's the first hope, is like, is this something we can treat? If not, then we might go a little bit deeper into some of the other tests. So MRI might be one of the first things. Blood work, of course, is the first thing, because we want to see, is there something else going on? They might then, if they can't find anything definitive there, they might say, hey, what about a lumbar puncture? And that's something to get a CS, cerebral spinal fluid. And in that, we'll get some to see if there's certain levels of amyloid and tau proteins. And that can start to guide us to say, oh, it looks like it might be Alzheimer's or not.
Interesting.
Yeah, and then there's things called PET scans, amyloid PET scans. There's things called DAT scans, and that's more if we think maybe Lewy body is happening. So you can see not everybody's going to get all of those tests. Sometimes it can be pretty clear immediately what might be going on. But again, there's, and also because it's progressive, it also takes time to see, is this progressing? Is this something in time that is getting worse? So again, we want to be really careful upon labeling somebody that they have one of these types of conditions.
Right.
So I think it's really important that they're really thorough in testing.
Sure. Well, you said you can't really look at the brain, but I thought there were new scans where they could see that certain parts of the brain were no longer functioning or had taken on a new look, or I thought we were.
Well, we definitely have that, like the MRIs, the PET scans, the DAT scans. I'm thinking of, when I said that, it was more of the heart, right? We can see a heart pumping, we can see a valve is blocked, we can see very clearly what's going on. With the brain, we do have imaging that tells us these hot spots of maybe these areas. So we definitely are getting much more information these days. But it's not as clear cut in some areas. Sometimes it is pretty evident, but
what about a traditional CAT scan, or maybe for a condition like Alzheimer's, you need to break it down to, for example, PET or DAT, right?
So there's just different types of scans that provide different types of information. And so the neurologist will know based on maybe some symptoms that they're seeing, maybe one test came out this way. So they're going to use their best clinical decision to say, this is the next step. We want to be as less invasive as possible, but at the same time, we want to get as much information. And then this is, again, up to the person. The person might say, you know what, I'm not interested in doing that lumbar puncture or doing all these scans. I recognize that this is a dementia. I'm okay with just knowing that. And again, there's no right or wrong how anybody navigates this.
I want to touch on music. And here in Chicago, and I think it's starting to expand in other parts of the country, there is a choir that is geared toward people who have early stage cognitive impairment and their care partner. It isn't like a daycare, you drop your person off. They really have to be participating. And then there are a group of volunteers that work with them. And they had a wonderful coverage on local WGN TV here in Chicago this past week. And I happen to know one of the women who was interviewed, and I knew her when she got involved in that choir. And she said, I'm not a singer, and most of them are not, frankly, and it's not a prerequisite, but she said, I knew something was happening. She said, I just wasn't tracking things like I used to track. I wasn't remembering things like I used to remember. And I decided to try this choir anyway. And she said, it has made such a difference. And just learning the music, which she has never been exposed to in the past, just all kinds of things about it are really proving to be very positive. Or can you talk a little? And then I remember seeing some videos in the past about people just coming alive. They're almost catatonic, and then when they hear music or you get them in a conversation about music, it's like they come alive. Can you talk a little bit about the impact of music on the brain?
Well, I'm not a neuroscientist, so I can't talk too much about that, but I do know that any creative program, music, for example, we know that music, it seems to be really in that deep embedded part of the brain that sticks with people a little bit longer. But you're talking about two different things. One is that element of that music, that deep impact, like that music, which is really great. And ongoing as it progresses, music can be a really great grounding, a really great place of connection and meaning for a person. I know one of our doctors, Dr. Borna Banakdapur, does a lot of research in music. He has a music museum. He has a whole new studies of music that he is looking into. He's working with the choir that you just mentioned, Good Feelings Choir. And I just think it is something to be studied. And I think it's an exciting place to see how music can impact people. The other part of that is the quality of life aspect. So again, we're talking about sometimes the symptoms, all the things that are going wrong, but my role is to kind of say, hey, what's going right? And what are the things can we do once we have this diagnosis? And that is to build on the strengths, that resilience you were just talking about, Frank. How do we build on that resilience and kind of like, ooh, how do we have people stay social, stay engaged, learn something new? Again, I think of it as physical therapy for the brain, staying stimulated, doing things to stay connected. And so that's really important. And that can in itself uplift mood, because we know mood can impact cognition. So all of these things, even though it's not a cure, but again, it can really be have such a strong positive influence. And I know for me, and at Northwestern, that's something that's been huge. We've really done a lot of novel programming, quality of life programming. Music obviously is one of those that we're studying very much so, but we've done improv, we have done storytelling, we have done art. And so it is something that we are passionate about in terms of helping people stay connected and engaged.
Right. Well, we're about to be in our second break, but with everything that both you and Karen have just shared, this primes me to really discuss about my case involving a family member, which I think I've already learned a lot. So I'm going to ask you questions as applied to my family member, but I'm trying to find the way that the whole family can look at this particular case in the mode of resiliency. So when we return right here on talkradio.nyc and Frank About Health, we are going to cover an actual case study involving my cousin. And please stay tuned. See you in a few.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host the program Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on talkradio.nyc, and I will continue to be frank about health with all of you.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Welcome back, everybody. Okay, I'm just going to go right for it. Now, Lauren, I have to say that I have been pretty much silent watching you and Karen discuss all of these nuances of the different types of the dementias, the discussion of resiliency versus resistance, the issues of testing and whatever. And here I am reliving in my mind an actual case of my cousin since 2021, post-COVID. And we're at the point now where the condition has progressed so at a point where we're looking at different treatment centers, daycare, long-term care, stuff like that. But I want to go over some of the stages that I observed as her caregiver. And I want to know if the way I handled it with her neurologist and the way I'm handling it now with her other sister, who's her power of attorney, if there's something that I'm missing. Because believe it or not, in this month of Alzheimer's awareness, I'm going to be involved with her primary care physician, requiring or requesting the right testing. And I'm going to be interviewing a daycare center in Washington Heights, New York City, where we want to place her, meaning she comes home at night, because it's not at that point where she needs to be put into a long-term facility, thankfully. And also, in this dialogue I'm about to present, I'm going to show you a case where I was believing, like everyone else, this is Alzheimer's, but proof came that it was actually self-inflicted through overuse of tobacco, which qualifies it as a form of dementia, but more than likely not in the Alzheimer's variety. So, that all being said, back in 2021, I received a phone call from her son. I'm leaving things nameless because I just want to create a scenario that probably others can identify. And all of a sudden, she was calling her son by my name, or she would get on the phone with me and call me by her ex-husband's name. But little skips of memory, nothing too noticeable. She would still know who I am. We would still go together to the doctor or to the movies or to restaurants. And then all of a sudden she would be mistaking birth dates, or just little nuggets of facts from childhood would be skewed or represented differently. In 2022, we're all not wearing our masks anymore, and she was undergoing eye surgeries, and she had a cardiovascular event 10 years ago that turned out to be something that was misrepresented by the hospital system she was affiliated with. But I was fortunate enough as her proxy to get her to the right PCP, the right neurologist, the right eye surgeon, all the right necessary doctors that was able to give us a whole package of her rehabilitation from the cardiac episodes, in addition to this newly developing cognitive dysfunction. Mm-hmm. It wasn't until Mother's Day of that year that we decided to go get, I think it was a PET scan. And all we were told is that there was shrinkage in 2 of her lobes, but there was no indication of that plaque that forms for Alzheimer's patients.
You can't see it.
Or, I'm sorry.
You won't be able to see the plaque.
Oh, I see. That you would see.
So you would see an MRI, you would see maybe some atrophy, we call that, right? So some shrinkage, if you will. So that could be exactly what the doctor was seeing. So that indicates maybe there is some changes happening. So anyway, I just want to let people know, yeah, you can't see the plaque. That's cellular.
Oh, and that requires another test besides the MRI to find that out.
That is actually upon autopsy to see any plaques and tangles.
Oh, okay, well, she's not deceased, so I think the autopsy won't be done.
We're not there.
We're
No,
not there.
that's what I mean, though. That's why it's hard to see, because to get to that level, we just aren't able to see that with like an MRI or something.
Okay, no, I understand. Now, granted, she survived all of the surgeries in her eye. She had a shunt removed. She had glaucoma problems. All of her eye drops and medications were recovering that. She, at the same time, her heart was feeling better. She, at the same time, was taking medication for that. I think it's called losartan or losartan or something like that. However, she was starting to experience changes in knowing if the television show she was watching was a real person or was actually Perry Mason, meaning the show. Now, when I noticed that was pretty much at the end of last year. And I thought, okay, things are starting to decline a little further, but after the results of that MRI that I described, she was prescribed 2 medications to slow down the cognitive dysfunction, or as the neurologist referred to, memory loss. One was called donepezil, and another was called memantine. In my mind, I still thought, like everyone else thinks, as we said earlier in the show, that she was progressing through Alzheimer's. And I thought maybe it was a form of cardiovascular dementia from her. I think she had something removed. I don't remember if it was open heart surgery or if it was a bypass surgery. And then probably after 10 years, lack of oxygen through the carotid arteries led to whatever could have occurred in her brain. That was proven by her cardiologist not to be the case. Then we decided her son is what they call her CDPAP worker, Consumer Directed Patient Assistance Program, and through the Medicaid system. And at the same time, we thought to avoid the wandering that started out, we would get her a PCA, a primary care attendant, to come into the home on weekends, which we got approval for. And when she did an evaluation of her, she said to me in front of her, "You do not have Alzheimer's disease. You have cognitive decline, but you're smoking too much." And it turned out she was smoking too much. She was hoarding cigarettes 5 times a day even, and continuing to deny that she was doing that. And when I would take her for her annual physical, her blood pressure would be like almost 180 over 100. And she would say, "Well, I don't know why, because I'm not smoking." So, okay, that's an interesting aspect of, is she literally forgetting that she's not smoking? Or maybe she's just not admitting it. But one can never know. And as her caregiver, all I could do was find her the right treatment. But it became referred by this PCA as, I know this is not part of the spectrum of conditions that you mentioned in the early part of the show, but it was almost like she was creating toxic poisoning to her brain through the tobacco. Oxygen debt, I presume. I mean, I still don't know the facts versus what the doctor says, but I'm at the point where she's not going to stop the smoking, or at least her son has advised me that she stopped smoking a month and a half ago. But that's not up to me. That's up to the doctors to know for a fact. Now, going forward, though, she's at the point where we'll have a conversation and something else comes out of her mouth. So regardless of what it is, the focus is she needs to re-engage with the right environment of people, maybe get some music support, maybe learn to play games, maybe they can watch Perry Mason together and talk about it, joke about it. And there are facilities we are looking into for that. And luckily, her program that she's tied into will cover it. So we're going through that evaluation process, but this very Monday, we're going to be taking her to her PCP, and being that the neurologist did not want to offer any particular testing to determine what type of dementia she has, I'm wondering if you think that asking her primary care physician for such a request is doable. Or is that something that a neurologist is supposed to be the one to request?
It's hard. Everyone is so different. Everyone's medical team is unique. I think, it sounds like there's a complicated health history here and a lot of health issues that are very complicated, as well as psychosocial concerns. And, what you can just do is convey, I think, not everybody is going to get all that testing. Again, it just depends on the provider. And so you can always talk to the PCP about your concerns. I think that's always very helpful to see, would other testing be beneficial? Talk to the PCP. Would a second opinion be beneficial? To learn, there might be reasons, there's often reasons why a neurologist doesn't maybe ask for a certain test. I know for us, we have rounds every week where we're talking about, and there's great discussion on what next testing might be helpful, if any. So just know that everybody, again, it's really up to her, again, her health history and her medications and all of that is very complex, it sounds like. And so it's really having them look over, making sure that any immediate concerns are taken care of, and then they can maybe make recommendations. But if you're seeing something and you're concerned, I always think being an advocate for whoever it is really important too. And just saying, hey, I wonder, and start having a conversation and asking, and they might let you know, oh, you know what, this is why we didn't maybe look at that. Or this is actually, this is maybe something we can do.
What's the best advice for Frank, acting as one of her co-caregivers, for his behavior and how he should be treating not only the situation, but treating her?
Right.
Well, I think like anything, like again, it's treating someone with respect, and it's honoring someone's autonomy and self-determination as much as possible. Adding support as you're able to. Really supporting the main care partner. This is somebody, again, I can't give any advice. I wouldn't be able to do that. But what I can do is, again, as long as it sounds like you're supporting whoever that power of attorney is, staying engaged with the person is really important. Or, again, anything showing empathy and compassion and saying, hey, let's, staying engaged, doing things, and hearing an adult day program, seeing what resources are there to support them. That could be really helpful. Anything really, again, based on whatever her care providers or their care providers are saying, and then helping whoever her main or their main care person is, to then support in any way that you can.
I get, which is what I've been doing. So I gather what's happening throughout the month is I'm working with her son and her sister, the power of attorney, and directing them to the right channels of communication, other than, of course, myself visiting this daycare center, because she does need to be in a safe space, knowing that she can also have her agency to come back.
And there's no right or wrong how to navigate. Every family is so different in terms of the level of support people are able to give, who's going to be in their life to support there's resources, financial resources, geographic resources, community resources. So it's so different for everybody. The symptoms are different. And even what you were sharing, it sounds very complex about whatever's going on. We're not sure what's going on, it sounds like. And so part of this is really how to best support that person so they are safe, they're engaged, they're supported. I think that's the focus of care.
At the same time, leave the testing to the medical professionals rather than requesting it just because you're presuming something. You're not really, one is not really, the caregiver is not really in the direction of requiring or requesting a test, correct?
Well, hopefully the doctor is the one who's saying, oh, this is something we want to make sure this test might help us, give us more information. Not every clinic is set up like ours, maybe also. But again, families, I have talked to families all over the country, and, if you have that family member who if they feel like maybe something's getting missed, then that person has to be an advocate and say, hey, I'm seeing this. And hopefully you have a care team that's able to be in conversation with that person and to say, yeah, okay, I hear you. Let's maybe look at this.
Well, we're about to take our final break, and I guess, if anything, we're just going to wrap up all of our futures based on the understanding that we've learned today all about Alzheimer's disease and related dementias, as well as this music program. I mean, I've always been an advocate for music therapy because of my history in the music industry, but I do believe it definitely works on the brain. I, being an epileptic, have learned and appreciated the value of it for seizure control and recall in a post-ictal state. And I value music for that same, not medicinal value, medical value. All right, ladies and gentlemen, we'll be back right here on talkradio.nyc and on all of our socials. We'll be back in a few.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Broncu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
About Health on talkradio.nyc. We are talking today about Alzheimer's disease, dementia, and our special guest is Lauren Dowden from Northwestern University. She is a part of a program there that focuses on Alzheimer's disease and dementia. And Lauren, we appreciate you joining us today. You've just shared such valuable information. And to kind of wrap that up, let's back up and say, what can we do or can we do anything to stave off dementia or Alzheimer's disease? Are there things that we can do in our lifestyle that will make it less likely that we might succumb to the condition?
Well, again, that's why I'm part of a research center, right? So there's research centers all over the world trying to better understand this. And right now there's not a direct link, but we do know that, heart healthy lives, things like staying social, staying engaged. What's good for your heart is good for your brain. Eating well, Mediterranean diet is often touted as something that can be really beneficial. Exercise. Getting good sleep hygiene, mood, right? We know mood can also impact cognition. So anything like that, healthy relationships and all of those aspects, again, it seems maybe intuitive, but without, there's not one linkage. It almost feels like I had one person that I used to be in a support group. He had dementia, a type of dementia, and he would say, we're all eligible, right? So it's this idea of all we can do is try to take the best care of ourselves as we can. And sometimes we're still trying to understand if there's ways to prevent it more directly.
Sure. Before we wrap up, remind us just what, I know you said you're a research center, but if people are in or around the Chicago area and want to reach out to your center and get some information or some guidance, what is your suggestion? How do they get in touch?
Yes, please. If you are interested, we are the Mesulum Center Cognitive Neurology and Alzheimer's disease research, right? So I would say come, and online, if you're interested in being a part of research, we do clinical trials. We offer research opportunities. We specialize in something called primary progressive aphasia, which is a language-based type of dementia. A lot of atypical types, younger onset, as well as frontal temporal dementia. So I would say visit our website. So brain.northwestern.edu. That's the Mesulum Center website, and there's a registry there. And if you sign up, we can see, hey, would you be eligible for one of our clinical trials, one of our research programs? We are always inviting people to take part in this research because it's so important, because while we've taken strides, we have so much further to go, and we can't do it alone.
Yeah, give us that website once more.
brain.northwestern.edu.
Great, perfect. That's easy enough to remember. Again, thank you so much for being with us. And I'm going to take just a moment to talk about Karen Ross now.
Yes.
And I, as Frank mentioned earlier, am a certified hypnotherapist. I work with people on issues, not dementia related, but issues that people have held on to for a long period of time and just have not found a resolution. Often hypnosis can be that last thing they try and it works. And I should have asked that question, Lauren, if it plays a role in your work at all. Do you have a real quick answer for that? Does hypnosis even come into play in the work you do? No.
I have not heard of it yet. I have not heard of it yet, but you never know what's
You
around.
never know. You never know, because people are still under the assumption that hypnosis is something they've seen in the movies or seen on TV, and that's the worst representation possible, because it's a very effective procedure to help people. So I welcome people to come to KarenRossNow.com and just have a complimentary conversation and find out if hypnotherapy could be an answer for you and what you're experiencing. So Frank, tell us a little bit more about health and what else happens on talkradio.nyc.
Absolutely. But Lauren, I think you just said there was one more thing.
I wanted to throw one more teeny tiny tidbit, because we've been focusing on so much of, these cognitive, impairments. You were talking about resilience. And I want to say, of all the studying that we're talking about, we also study what's called super aging. So we're also looking at people whose cognitive levels are that of somebody 20 years younger. So that's for people 80 and up. So I just want to share that we're doing a whole spectrum of cognition. So again, if you're interested and you think you might be a super ager, yes, contact us as well for that.
Oh, that's
Very
great.
nice.
I've seen people interviewed on TV who are over 100, and you would think they were 25 years old. They are so with it.
Yeah, we celebrated our 25th anniversary of the super aging program just yesterday. So again, it's another way that we are studying the brain. So thank you for.
Fantastic.
One such person I can think of offhand, and I've been fortunate in my lifetime to meet her, is Betty White. I mean, to have her third career from age 90 to 93 before she finally took her final bow. I mean, she was.
Well, it's a Guinness record for the longest spanning career.
Absolutely. And she started in radio before
TV.
Exactly. Oh, wow. So basically, ladies and gentlemen, there is a lot to promote, as Karen was asking me, but I want to point out that by celebrating Alzheimer's Awareness Month, by actually identifying with my personal case that I have been dealing with for as long as this show has been on the air, 3 years now, has been a journey in itself behind the scenes. It's been one of the motivations as to why I launched this podcast. Everyone knows I wanted to talk about epilepsy and remove the stigma. Everyone knows I wanted to come back during COVID and really instruct people on what is true and what's not. Everyone knows that I've had my mainstay co-host, special guest, Karen, and of course, Hilton. But what most people don't realize is that Frank About Health has been a predominant message of advocacy advocacy is important for all of us to be in charge of when it comes to our mental health, our physical health, cardiac health, cancer health, everything we've talked about the last 6 months since the year began. The thing that is going to be more emphasized in the future going forward is how we can take the content that we share right here on Frank About Health and expand even further. So I will be announcing shortly, as I did on last week's show, the launch of healthymedia.com in July 2024. And maybe, Lauren, you mentioned some doctors that you work with in your lab, as well as the music therapy program and stuff. Maybe we can have further conversations beyond this particular episode, which I hope, because I'll probably need some help in engaging as I watch my cousin go into daycare. But even more so, next week, there is going to be a special guest on the hard skills, and that will be me, yours truly. So I will have more information to share about the healthcare system, about other kinds of views that people, patients, the practitioners in those systems need to become more aware of. And it should be also another kickoff to the next 3 episodes of Frank About Health, wrapping up in June with the current season. So, ladies and gentlemen, I think we're about ready to end, but stay tuned for tomorrow's schedule of shows, starting in the morning with Philanthropy in Focus and Tommy D, and then always Friday with Steve Fry. On Tuesday, I'll be there on the hard skills with Dr. Mira Branco spot. And after that, after next Thursday's episode of the Conscious Consultant Hour and Money, Power, Politics, and Health, may have gotten the title wrong, but there'll be another episode of Frank About Health. So that all being said, thank you all today for listening. Thank you, Lauren, for coming. Thank you, Karen, always. Thank you, Hilton, for hosting me here each month. And thank you, Sam, behind the scenes, and Logan behind the scenes, and Emily behind the scenes. So stay tuned for the rest of the thing right here on talkradio.nyc, and we'll see you next week.